Welcome to everyone. In this topic, evaluation of organ function test. Organ function test, liver function is health disease, jaundice, hepatic, LFT. Assignment clinical manufacturing, renal, hepatic, pancreatic, gastric, intestinal function. Temper, pancreatic, organ, and lipid tract. Test of myocardial infarction. Introduction liver function test. LFT excellent diagnostic tool. Liver is working tool to measure different enzyme protein substance the liver produces or processes. The level of substance can affect the liver condition, the hepatic fatty acid and or jaundice. The liver function test purpose goes to identify of lineage. The course of treatment as well as make sure your liver is healthy. The type of liver function test. First only LFT test, AST test, ALP test, bilirubin test, albumin test. First one the ALT test, alanine transminase. That the same usually found in the liver. Level can also liver damage or disease. AST test, the presence in liver muscles such a high level might call for either liver or muscle disease. ALP test, alkaline phosphate. MCM help break down protein and often detect black bile ducts or liver problem. Bilirubin test, the jaundice, liver disease and bile ducts and observation. The main function bilirubin, blood, WBC or breakdown. Albumin test, protein mode liver, low level high signal liver disease or chronic condition. The type of liver test, albumin test, ALT, THT, bilirubin, ALT test, the blood test for specific parameters to focus different sectors. Healthium, most common only. Liver function test important. To identify liver damage. Second one, monitor disease process, evaluation treatment etc. First thing, whether the due to alcohol contributing to infection like hepatic medicine side effects. LFT can pinpoint the early identify liver damage. Monitor disease progression. Have a condition of fatty acid. Regular LFT track disease project check. Evaluation treatment efforts undergone treatment liver disease. The treatment medicine working the intended. Preparation of for a liver transplant. A fast and liver test. Doctor made also fast or 10 to 12 hours before the test. Cannot be any food drink anything except in water. The fasting junior accurate result is kept the test of like bilirubin. Medication and liver test. The medicine is supplement is taking the some drug affects the liver enzyme level and nature before the test. Stay hydrated. Drinking water make the blood more smoother. The proper preparation of more reliably liver function and test result. Liver function procedure. The test procedure is simple and is quickly involved in the routine the blood draw. During the test, helps prevent and cleaning the area and insert a small neatly selected blood sample. Championship procedures usually are painless and overwhelming. Post-test sample is collected. Your daily useful blood is sent to a lab analysis and the result is available within 24 to 48 hours. Understanding liver function test result. Liver function test result of overflow break better breakdown to make CHA. Normal value ALT level up to 30 UL bar woman 45 U bar L man. Bilirubin level should be the 1.2 mg del. Abnormal result high ALT AST high liver damage low albumin should point is chronic liver test. The abnormal do not panic. Your doctor will explain the medical subjects additional tests for treatment necessary. Condition detectors of liver function test. You have to reveal the liver-related condition, the hepatic inflammation of liver caused by infection of the factor, such as liver disease, structural liver cells, often linked to observed alcohol use. Here also carrying the liver due to long-term damage, liver cancer, abnormal growth, or tumor in the liver. Jaundice yellow of the skin is caused by the high bilirubin levels. Detecting this early can lead to a better outcome and more effective treatment. Liver cancer and liver cancer symptoms. Risk and limitation of liver function test. There are minor procedures comfortable blood injection in metal. Temporary resolve on their own. Also has a limitation. Depending upon the exact catch of liver additional tests such as liver culture monitor. Symptoms of liver disease: fatigue, abdominal pain, yellow of skin, jaundice, or dark urine. Routine check-up risk factor like alcohol use observed. Monitor respiratory condition, hepatic or fatty acids. Medication side of effects prefers a long-term medicine that could affect the liver. During the test, the small little intestine vein the overhang. A needle attached to small tube collected a blood. Inserted to arm they'll have a short time neatly they removed. After the test, the blood goes to laboratory for analysis. Lab analysis happens within hours. The blood after the laboratory to make the result within several time day. Result is standard blood test. Typical function tests include ALT 7 to 55 unit per liter, AH2 8 to 48 liter, ALP 40 to 129 unit per liter, albumin 3.5 5.0 gram per deciliter, total protein 6.3 to 7.9, bilirubin 0.1 to 1.0 milligram, GGD V2 61 unit per liter, LT 22 unit per liter, PT 9.24 to 11.2. The result is typical adult men. The range of results is different laboratory to laboratory. A child different in women and children. The diagnosis of condition detected treatment may need. The help in the diagnosis liver disease, liver function tests help in determining progressing if severe respondable treatment. The jaundice, the yellow discoloration of eye, the skin due to hyperbilirubin according to the bilirubin level of greater than 50 micromolar per liter. Yellow discoloration. Pathological. The jaundice result high level of bilirubin in the blood. The normal blood pressure produces catabolism, scheme, this formatted disabled red blood cell. The bilirubin conjugated liver making the water soluble gastrointestinal metabolism urobilirubin, a majority which the excessive files are thyrocoplane metabolic breakdown produces urobilirubination. Into the floors excessive kidney jaundice occurs in the pathway disrupted. Bilirubin produces scheme metabolism. Ischemic blood pressure, hemoccretion, biliverdin, bilirubin cassette, blood test, chloronic acid removed by bacteria, bilirubin circulation phase, enterohepatic circulation via portal vein. The type of jaundice is jaundice prehepatic, hepatocellular, and post-hepatic. The prehepatic jaundice is breakdown our liver ability conjugated bilirubin. The conjugated hyperbilirubin anemia. The any bilirubin may the conjugated excreted normally. Unconjugated bilirubin remain in the blood captured jaundice. Hepatocellular dysfunction hepatocysts of the less ability the conjugated bilirubin fibrotic tissue compression hepatic protein bilirubin tractors degrees of observation. The conjugated and conjugated bilirubin in the blood determine the mixed picture. The jaundice observation ability bilirubin now check the conjugated by liver since the result conjugated hyperbilirubin anemia. The tables in prehepatic, hepatocellular, post-hepatic, hemolytic anemia, platelet syndrome, hepatocellular alcohol, liver disease, viral hepatic, hereditary hemochromate, autoimmune hepatic, primary platelet, hepatocellular, intraluminant gases. Cases of alcohol extramodal gases, pancreatic cancer, abdominal masses, lymphomas, post-hepatic. The slide laboratory test patient presented jaundice with liver function left is summary table configure table PT FFTC anemia disease MCV thrombocytopenia in the liver disease. Specialist blended tests summary blood mark blood marker blood albumin AST and ALT alkaline phosphate gamma GT. Blood quantity of degree of subtracted jaundice, albumin marker liver synthesis function, ACALT hepatic cellular inferior, alkaline phosphate, bilirubin and boric acid, urine pregnancy, greater malignant, gamma GT, ALP over specific bilirubin observation 10. Liver cleaning, acute inferior, chronic liver inferior. Acute liver inferior hepatic A, hepatic B, hepatic C, and hepatic E, CMC, BL2. Non-infection marker, paracetamol level, cerulopsis blackman, anti-nuclear antibody and IgG subtype. Chronic liver inferior, hepatic B, hepatic C. The tissue including antibody, albumin, and antitrypsin antibody. Imaging. The imaging usually depends on presumed arteriological. Ultrasound abdomen usually first-line observation pathology present. The cartoon in gallbladder for the liver pathology after the user dependent. Magnet shows colon angiographic MRCP used a very typically performed in jaundice. Observed in the can be the information ductal tone, biliary structural and pancreas matchup, catches a biliary observation. Liver biopsy performed as a diagnosis, not made up disease investigation. Management. The future treatment of jaundice will be depending on underlying cases. Colonoid pancreatography. The common blood test performed to reduce the risk for observation of future should be the chelodoheterotomia, remove the tone once of the touch of clear. Symptoms of treatment neatly reduced with cassette of hyperbilirubinemia. The mandatory colocropy-based treatment that promote vitamin C or fluorescent plasma FFP neatly evidence bleeding the rapid coagulating and treat hyperlinemia orally partially 5% and discharge neatly. The chronic liver disease, hepatic encephalopathy, laxative lactose chimina, nomacin, fosmacin may be used to attempt to reduce the number of ammonia producing bacteria in the bowel. Measurement of renal hepatic pancreatic gastric acid intestinal valve combination, patient history, the renal function kidney and the hepatic function tissue. The renal function FRT kidney ability to filter waste includes a serum, creatinine, blood urea, nitrogen, glomerular filtration rate, clinical infection, fluid urination, edema, change in urination of frequency of hypertension, hepatic function liver, the liver function test LFT, metabolic detoxification, and the synthesis function. The key tests include albumin, bilirubin, ALT, AST, alkaline phosphate, prothrombin, and time. Clinical jaundice, yellow, keen, and abdominal pain, critical dark urine, and the hepatomegalia. Pancreatic function and the gastric function. Assignment relevant enterogram blood sugar and scoring diagnosis function tests include the serum amylase and the lipid. Clinical manifestation epigastric pain, back to and nausea, vomiting, fatigue stool, and the weight loss. Gastric function stomach action. The protection of MT related to gastric acid analysis pentacastrin histamine. The endoscopy later use ulcer and the gastric level of Wilson syndrome. The gastric pain, the nausea, vomiting, hemodynamia, and intestinal weight loss. Intestinal function test, small object, evaluation observation, modulation, inflammation. The stool analysis, inflammation, DST, mal observation, endoscopy, colonoscopy, and abdominal imaging. The diarrhea contributes abnormal pain, blood infection, mal observation, and blood in stool. Pancreas, soup, the gallbladder, temperature, small intestine, and bile test, inflammation in pancreas. Enzyme pancreas organ, the pancreas secretory of the duodenum predict on carbohydrate protein fat. Major pancreas enzyme trypsin, chymotrypsin, carboxyl elastic. function breakdown to a peptide amino acid, amino-carbonic indigestion, pancreas amylation function, sours and maltose testosterone, short converted maltose testosterone. Lipolytic fat digestion. The pancreas to impact protein A to a cholesterol function, fatty convert to fatty acid glycerol. Nucleosis, ribonucleic nucleic acid to nucleotide. Clinical important amylase and lipase to catechin pancreatic. Enzyme deficiency, maldigestion. Enzyme bile-driven tract. The bile-driven tract liver gallbladder does not to produce digestion enzyme. The produces instead to no enzymes compound bile slab bile-driven cholesterol phosphorylation. The function of bile emulsification of fat, breakthrough fat into the small droplet. Pancreas lipase overcarry and observation of fat soluble vitamin A, D, E, K. Clinical important observation genetics of digestion impaired, pale, cold, and dark urine. The pancreas bile-driven tract association. The pancreas juice main typical and common bile test. Liver gallbladder, ambular veteran enters the duodenum. The control of release of bath of pancreas enzyme into the small intestine. Biliary disease is impacted. Secretion of enzyme studies the through pancreas amylase and lipase in bile pattern to be hepatic biliary disease. Clinical ALT is still indicated pancreas bile metabolic enzyme activation pattern. Pancreas auto digestion of protein enzyme secret inactive fermented only inviting open the reaching the duodenum. Top diagnostic tests: electrocardiogram, the primary military electrical signal, identify abnormal heart rhythm or signals of damage. The blood test, cardiac marker, biomarker diagnosis, myocardial infarction. It is fractation and infarction, peak of quickly the lifestyle specific troponin. Echocardiogram, the heart moving the pump blood, identifies the damage in the area. Coronary angiography, the external look the black area of supply the heart. CDMR, imaging visual heart, structural and successful chair. Myocardial infarction, heart attack, diagnosis immediately electrocardiogram, measure electrical activity, blood test, the check-up cardiac marker in troponin. Echocardiogram is just a coronary angiographic treatment of heart muscle damage. Time from blood detected damage is 4 hours. Jet pain level at potential state of level over 4 to 6 hours. Peak in the 12 hours. The useful diagnosis early infection. The myocardial infarction, investigation of NST DME, the non-specific tested the digest RS system, RSCS, NTME, surgical RS, a typical vessel disease, left main temp disease, double vesicle disease plus DM, modulator clinical drug, aspirin, staining, beta blocker, ACE infection, chlorobacterial nitrate.